having extremely high cognitive power, or IQ, is a version.
Hi guys, so I got tagged in this video a few times and I'm here to say I completely agree. I found the same thing. There's a certain type of neurodivergence that's associated with very high IQ, but probably not for the reason most people think. So it's usually more associated with the people who have ADHD traits, but it doesn't mean they're more intelligent at all, actually, and I'll explain why, but you have to bear with me, it's a bit complex. So the easiest way to understand this is to realize there is a gender dimorphic element in neurodivergence, because the mechanism by which it manifests has to do with the hormone environment in utero, so before you're born, and in the first 6 months of life or a year of life, because that's when the brain gets wired. That's the maximum effect you're going to get from any hormone exposure. And that's why neurodivergence is about 7 times more common or 6 times more common in the LGBTQ community, because it's all epigenetic. It's the same mechanism. Now, the other thing that people don't consider enough is in medicine, there are always excellent clues in the way the disease or condition or label presents itself. So think about the word spectrum. What can give you a whole spectrum? It's most likely window or windows of exposure during certain weeks of the pregnancy, multiplied by the net concentration of the androgens and estrogens during those windows, and then added up together. That gives you the total brain pre-programming. And as the child grows up, if they've got overall androgen exposure, they'll start presenting hypermasculine brain traits or autism traits. And if they meet a certain number of these traits, they will then be given the diagnosis. That's the cutoff point, the threshold. So it'll be like the 35 on the autism quotient test, I think. Now, the following is my opinion. There's no formal research to back it up, but the opposite side of the autism is the HSP, not the neurotypical. HSP is what I call estrogenic autism, or high estrogen traits or states in utero before birth. So that could be a man or woman, of course. And the middle is ADHD. So ADHD is a man with some feminine exposure to their cognition. And in women, it's the opposite. ADHD is some masculinization to the cognition. Basically, that's the whole spectrum. And a man or a woman can be on any part of the spectrum, but it's more likely so the autism is more likely in men, and the HSP, or the estrogenic autism, is more likely in women. So this is why ADHD can sometimes even falsely score higher on IQ tests, because essentially you have bicognition or androgynous cognition. So you're going to score reasonably well on all the subtests. You're not going to max out any one of them. That's why ADHD people are more likely to be jack of all trades. Now, a far end of the spectrum autistic person might be monotropic in their skills, so they might do very well and even be an unhinged genius when it comes to mental rotation tasks. And the deficits might be a few other subtests. The problem is the tests are capped, right? You might have a score of, let's say, 150 for mental rotation, but this genius and another person who's very good at mental rotation might score 150. But if you uncap it in a hypothetical situation where the examiner can even think of more complex questions, they might score 300. And then the other person might score still 150. They might not go above that. And that 300 will then overcompensate or compensate, for all the deficits in verbal and memory. And therefore, you might end up getting the same score. The scores will equalize. But there is no way to do that. It's very difficult to come up with these type of questions. Now, it's also good to keep in mind what the strengths and weaknesses of each side of the spectrum is, because a lot of the animosity that comes from society is not only from the lack of communication because of the breakdown in communication styles between the neurotypes, but also because my weaknesses could be the hypermasculine brain's strengths, right? And which they are in certain areas. So, for example, one of the tensions points between me and them is we have common sense. We have street smarts, the androgynous brains, because we see both sides and we can use the EQ and the IQ together with the long-term memory. So we have a database of memories where we can get context from for other events, for pattern recognition. All of that is basically what we call street smarts or common sense. Now, the person who is monotropic, who's good at one thing, you might say something to them that's to you immediately obvious, but to them, they're going to find it extremely surprising, and they're going to ask you for data or evidence, for example. That's what happens in my case. And then you can't do that, because why would you even need data for something so obvious from your perspective? Now, what's happening here is, in this situation, that person might be compensating for their common sense or reason deficits using data. They're trying to see the world through data. Of course, the world is very complex and there's an infinite amount of variables. So no matter how much data you have, you're always gonna be the last to find out, basically, right? That's why you like both sides need to work together. Someone has to synthesize the theories, and the hyper sort of tropic brain, monotropic brain, needs to prove it, not fight. We're not supposed to be fighting over the same thing. We're essentially describing the same problem and solution often from both sides of the spectrum, but we're just not seeing eye to eye in terms of communication and the rest of it. In terms of the other side of autism, which is estrogenic hyperfeminine brains, they might have some deficits as well, maybe around logical reasoning or mental rotation, but they compensate for with emotional depth and sensory depth and range as well. Okay, and that's what intuition is. So when you mix that with some logical reasoning, you get a very intuitive, excellent pattern recognition type of person.